if you make things very complicated, people won't do it. Yeah. And then in the treatment's got to be multimodal, basically. No one treatment, like education and talking to the patient about pain and education in work practices and all of that sort of thing is very, very important. If you just do that and nothing else, the evidence says it doesn't help much at all. Okay, pain education and nothing else, ergonomic education and nothing else doesn't do much. But common sense says that the patient must understand their pain, they must understand their ergonomics, so it's part of a multimodal package. And that's what we've got to stress. Multimodal treatment is the one that's important. Because, again, I can treat the joints very effectively with manual therapy, and there is evidence that you will get good pain relief with manual therapy. But if I don't re-educate the muscle system, the joints are going to get strained again. So that it's the multimodal. When I treat a neck pain patient, I'll talk a lot and discuss a lot with them. I'll also spend time making sure they do understand, and work practices is very important. I'll use manual therapy because it's very, very effective in relieving their pain. But from day one, I'll start re-educating their neuromuscular system as well. So I'll start to re-educate their deep neck flexors. I'll start to re-educate their extensors with a bit of a focus on their deep neck extensors. And then if they have got sensory motor deficits, you bring that in. So and as long as you bring that in the first or second treatment, it doesn't matter if it goes over a couple of treatments to introduce it all, but it is very important that you address each system, because we've actually also shown that it doesn't, just because the pain goes, doesn't mean that the muscle function comes back. In fact, it doesn't. It doesn't come back by itself. You've got to exercise and re-educate those muscles to work properly again.
Because then you're probably going to have a recurrence, right? If you don't